On Tuesday, the Trump administration signed an executive order aiming to expand in vitro fertilization access by reducing cost and barriers. Infertility affects 1 in 7 couples of reproductive age, and IVF treatment is a key option to help couples start a family, but it's also an expensive option, even with some insurance coverage. Many people have problems affording IVF treatment, especially low-income families. And the core thing for this order is that 90 days from now, there's going to be a summary of where steps can be made to improve fertility. Dr. Preston Perry with Positive Steps Fertility explains.
The two things that the White House has said intent for. We should not be standing in the way of building families. And number two, if you are covered by insurance, then insurers are supposed to do things to make it more affordable so you have less out-of-pocket payments if you are doing IVF. And it's wonderful. That's some of the most positive news we've heard in a while.
However, there are a couple of pitfalls. While the executive order may help, funding for it depends on Congress. Initially, it could mainly affect federal employees and the military. For others, there may be no immediate impact. Perry says reducing out-of-pocket costs for IVF sounds good, but insurers may raise premiums, make less profit, or even stop covering IVF coverage. Clinics might get less money, leading to overworked staff and lower quality care. Without extra support, these changes could have negative effects.
IVF's wonderful. It makes so many families and people who want kids to actually be able to have them. But it doesn't say anything about counseling, testing, inseminations, and other low-cost, low-tech treatments, surgery. There are a lot of things people can do without IVF, and we don't hear anything on that. I will celebrate any win. I will take anything that helps, families to have the kids that they want. But at the same time, there's a lot more we're looking for.
And this move follows last year's Alabama Supreme Court ruling on frozen embryos, sparking a national conversation about clearer protections for IVF. Perry is hopeful that this is a positive step in the right direction.